Is it true, the right face for the right job? Well, in fact, it is. More and more, believe it or not, men and women are going through plastic surgery as they feel that is what is keeping them competitive in the business world. We have a plastic surgeon with us today. We have Dr. Helen Colen. She joins us. She's a plastic surgeon that is practicing in Manhattan. It's nice to have you with us.
Nice being here.
Is it true men and women are having plastic surgery because they feel their jobs are threatened by the way they look?
Well, it is true that both men and women are undergoing plastic surgery more often now than before. And basically, it's not that their jobs are on the line, but they are more successful in their jobs if they look better. I think that cosmetic surgery adds a certain amount of self-confidence. If you feel that you look good, then you project that image to others. So if you have to represent your business, or if you have to represent yourself, and you think that you look good, you will do a better job of it. The most common procedures that we do nowadays is called, for example, the forehead lift. As you get older, you look a little angry, the eyebrow comes down, and you get frown. And you don't want to look angry, you don't want to look droopy. And for example, I had a gentleman who was in his late 40s. But because of frequently moving his eyebrows, he looked angry. And when he was a salesman, you don't want to walk into someone's house and look angry. So with a forehead lift, you eliminate, and then the person feels better and represents themselves better. Also, neckline that droops. You put your tie on, and the neck doesn't move with your shirt. Again, you look older, and if you're representing a young business, you know, you want to look younger and better. Women always enjoy new hairstyles and new clothes and so on. And you want to look better and less angry, less wrinkly. And I think it's basically self-confidence that these procedures give you, not necessarily a different look, tremendously different look.
Do you really see a large percentage, though, of your patients to be men? For, I think, women, it's become widely accepted that women will have plastic surgery. Men, we don't talk about it as much. Do you see the increase in that?
Right. Well, you're talking about most men a long time ago didn't have anything done. Now you see a lot of men coming in. Of course, it's not the same percentages as women, but for example, we have a great stress in our businesses, and a lot of people exercise. And you see men coming in because they have what we call love handles. So they would wear a suit and the love handles hang over. So people come for liposuction for that. I just had a young man who was in a great shape, but he was in his late 40s again, and the love handles you can't get rid of. So you'll get a patient for that. I think that more and more men are not embarrassed to come in and have it done, and it's a lot more accepted. And people talk about it more freely. And even the media, if you look in the magazines and so on, you see even the commentators on television all of a sudden come in and they look better. So there is more of an acceptance for cosmetic surgery. And with time, more and more men will come in.
How do men feel about going to a female plastic surgeon?
You know, it was interesting because at one point I was told that as a female, most likely I will not have any male patients.
Very unusual to be a female in this business, isn't it?
Right, very unusual. But it's on the contrary, I have a tremendous number of male patients. And I think that you almost are used to being taken care of by either your mother or your wife or your girlfriend or a nurse. So you come in to be taken care of. You don't look at it as going to a woman surgeon. And most men feel very free about discussing what they would like to be done. I guess perhaps if you go to a male surgeon, there's a little bit of, well, you know, locker room talk, well, I look, you know, hey, what about this? When you go to a woman, you don't discuss that. You say, this bothers me or that bothers me. So it's really does.
You must be asked for your opinion. Should I do this, doctor, or should I not do that? It must be difficult for you to...
Well, but you see, women enjoy that. Women usually are asked for their opinion. How do you look? How does this dress look? How do my hair look? And the husband asked the wife, how does the tie look? Does it match my suit? So you are always asked for your opinion. And in this respect, you are asked for your opinion. And of course, having training behind it, you are asked now for a professional opinion instead of just a qualitative opinion.
Sure.
Well, Dr. Helen Colen, we want to thank you for joining us on the program today. Interesting to see the changes.
Right.
And we'll be back with you coming up in a minute.